these are different sensors that what they do, Dr. Bob, is think of the pain that is involved in doing a finger stick or a glucose. It is my hope, it is my prayer that one day all our patients with diabetes or even pre-diabetes are wearing one of these pieces of technology that they can see real time what is happening to their blood glucose.
Is that possible?
It is here. It's not in the future. It is here now.
So show me that. So that's the sensor. Where do you put it? On an eyeball or on the chest or where?
So these different sensors can be put on the abdomen, on the skin
On the outside, on the skin.
on the skin or on the arm. But most insurances cover it. They're becoming less and less expensive. Anybody with diabetes who's on insulin can get one of those from their doctor, and they can see for themselves. Sometimes we don't want anybody else to tell us, don't eat this or don't do that. Even a well-meaning, loving spouse saying, John, you shouldn't eat this. Well, it's best if it came from within. So if they saw what was happening to their blood glucose, and I tie this into even exercise. When they go to walk, they see that the blood glucose levels are going down.
So is it a monitor sort of thing? What is it? How do they see it?
Very good. Used to be, and there are still monitors available, but technology, Dr. Bob, is becoming so elegant, they're all available or show up on the phone. So you and I, all our patients can see what the blood glucose levels are in real time on the phone with most any of these sensors.
That's out of sight. So you've got a sensor that sends the information to your phone, and when you're walking downhill, uphill, you can say, hey, this is what's going on with my blood sugar right then.
That's right. And then to make it even better, technology, insulin pumps have been around for a long time.
Yeah.
But now, for the last 4 or 5 years, there are pumps that talk to the intelligence that comes from the sensor. So the moment the sensor says blood glucose levels are going up, insulin delivery goes up. The moment the blood sugar is going down, insulin decreases. The delivery of insulin decreases.
So it's really we've really got sort of a solution. So we've got something that's a sensor that says, aha, I can tell you what your blood sugar is at that second. We've got a recording device, and then to our cell phone, it tells us what it is. That information goes to a pump. What's a pump look like? So
pumps come in different sizes. This is one of the disposable small pumps that
Can
is
you
good.
pick that up? Are you
able
to?
Of course. So this is a pump that gets a cue 24/7 from a sensor. And I think back to the days when people still do, check their blood glucose 2 or 3 times a day.
Yeah.
And you know what I equate it to, Dr. Bob? If you and I were to drive a truck, but the windows only opened 3 times a day, or the pilot is driving a plane, and they only see through the window 3 times, would that be okay?
That wouldn't be okay at all.
But here we have continuous navigation. So this glucose information is not just 1 or 2 times a day, but it's all the time. So we know when the numbers are high or low. And that just empowers, that educates. It's not designed to make a person feel bad when the blood sugars are going up. It's just designed to teach. It's helping them be in control.